Welcome to the Australian Nursing and Midwifery Federation podcast in association with the Australian Digital Health Agency, talking about how digital health is changing the roles of nurses, midwives and care workers. Throughout this episode, we will be exploring how nurses and midwives can use the Australian National Nursing and Midwifery Digital Health Capability Framework in their practice. Welcome to the A&MF's podcast. I'm Julie Reeves, a registered nurse and the A&MF strategic lead. Thanks for listening. I would like to begin today's podcast by acknowledging the traditional custodians of the lands each of us are broadcasting and listening from today. Currently, I'm talking to you from the lands of the Wurundjeri people of the Kulin Nation and recognise their continuing connection to country on lands and water that was never ceded. We pay our respects to elders past, present and extend our respect to any Aboriginal and Torres Strait Islander peoples on the podcast today and those listening. There's a lot of change happening around the world as we travel through the COVID pandemic, and that's true for all nurses and midwives as well. We are living in an ever-increasing digital world, and in our workplaces and homes, we are using digital systems as the norm. In regards to health, we know that digital health systems can reduce hospital admissions and result in fewer adverse medicine events. They also help to reduce test duplication, better coordinate complex or chronic health conditions, and result in better informed treatment decisions for consumers. Digital health is now part of our daily role as nurses and midwives, and we are finding an increasing expectation and need to be digitally capable as new technologies are introduced into our practice and healthcare delivery. So, a question for our listeners: how digitally capable are you? How do you use and manage digital health systems in your practice? The Australian National Nursing and Midwifery Digital Health Capability Framework is an easy way for nurses and midwives to reflect and complete a self-assessment on their digital capability. It was the first digital health capability framework developed in the world for nurses and midwives. And as you can tell, I think it has so much to offer our professions. Here to tell us more about the framework is Nicola Graham. Nicola Graham is the Education Manager from the Australian Digital Health Agency, and she loves horse riding. Welcome, Nikki. Can I start today, Nikki, by asking you, why is a digital health workforce important?
Thanks, Julie. It's great to be here today. There is a changing focus on health service delivery and care models where there is a cultural and behavioural shift towards consumer and patient experience that's enabled by the digital health. We need consistency in language and approach to influence efforts towards a health system sustainability. And this is where the Capability Action Plan comes in. It has 11 actions that go across 4 themes, and each one of those themes interacts with the others to help influence the upskilling in that area to effectively build a digital health capability across the health workforce to respond to the needs of the consumers now and also in the future.
Thanks, Nikki. I've met nurses and midwives who haven't heard of the Digital Health Capability Framework. Can you tell us about the framework and why we should know about it?
Yeah, the development of the Digital Health Capability Framework was focused on the foundational elements, such as organisational readiness tools and self-assessment tools for nurses and midwives. It covers areas to raise awareness of digital health and associated resources to support nurses and midwives' professional training and development. The framework consists of 5 domains which support the National Digital Health Strategy of safe, seamless and secure health and care services. So 1 is digital professionalism, 2 is leadership and advocacy, 3 is data and information quality, 4, information-enabled care and services, and finally, 5 is technology. Now, each capability domain has 3 levels which describe the growth of knowledge, skills and abilities, and these levels advance from formative through to intermediate and proficient. Now, each of those domains has 3 subdomains. The CAP is really flexible and it recognises that nurses can be at different levels of digital health capability and maturity, and it provides structures and guidance which can be applied to support that ongoing development.
Thanks, Nikki. I think it's also important to identify that the framework is structured in a way that is broad enough to enable it to be applied to all nurse and midwife roles across the professions, irrespective of your context of practice. It is important to note that your digital capability level is often dependent and reflective of your access to digital technologies at your workplace. For example, if you work in a fully integrated digital hospital, then your capability level might be higher than someone who works in a health service that remains majority paper-based, just simply because of their access to technologies. So, considering all this information about the framework, Nikki, what is the end goal of the digital framework?
Ultimately, the aim is for nurses and midwives to lead and be proficient in the use of digital health as an integral part of delivery of care, making their job easier and providing the best level of care for people, as well as providing a positive experience for consumers, clients, patients, carers, and their families.
You're listening to the Australian Nursing and Midwifery Federation podcast, where we share the voices of nurses, midwives, and carers. We are discussing digital health, our practice, and how the digital health capability framework can help to identify your digital capability. Joining me now is nurse practitioner Melinda Brooks. Melinda is a wound management specialist and she loves to dance. Welcome, Mel.
Thank you, Julie.
Mel, in your practice, how often do you have to chase up different kinds of medical records, relevant history, or results for patients?
Pretty much every single day, depending on where I'm travelling and the complexity of the patients that I'm seeing. Often I need to follow up discharge summaries if they've been in hospital or if they've been to a specialist, and hopefully correspondence has been sent back to the facility or with the patient about the outcome of that appointment. That's the sort of information I really need to source. And when I can't source that information, it certainly limits my assessment and recommendations for my patient with their wound.
Yeah, that sounds very frustrating on a daily level.
Absolutely. I had the scenario yesterday of a patient just got back from hospital and I had no idea, besides his medical history, medications and my assessment, no idea what's happened with the overnight stay when he's in hospital. I contacted his next of kin who couldn't give me much information either, that she hadn't heard from the treating team at the hospital. So that is really frustrating as to where the plan that I recommend goes to from there.
Yeah, it just limits health outcomes, doesn't it? And I guess that's where digital health can help. So Mel, you've had extensive experience as a nurse practitioner for nearly 17 years now. How has the transition to digital health gone in the health environments where you practice?
It's changed considerably. So when I first started nursing nearly 30 years ago, out in the community and aged care, a lot of the documentation was paper-based. And now there is only one facility that I visit that is paper-based. Everything else is electronic with various information software systems. So it certainly changed a lot. My notes used to be paper-based as well until quite a few years ago where I changed to a more secure software system for my notes and documentation. So, learning all of those systems and modifying how I practice has been a big part of the advancement in electronic recording.
Mm. Yeah, we've seen a lot, haven't we? It's interesting. I find it so interesting that each facility has different electronic systems. You know, you'd think there would be more a coordinated approach, but because you've got such broad experience with all these systems, reflecting on your digital capability, how do you feel or where do you feel you're at with your capability?
When I did the self-assessment, I assessed myself as intermediate. And the reason being I'm fairly comfortable navigating my way around the various systems I come across, and I have to document in their systems, of course, and then in mine. But I feel that I don't know each system 100%. So I think there's always room for me to improve as to the way I document and information I need from their documentation systems. I don't think I'm ever going to know it completely because I do come across so many different and varied systems. It'd be nice to have one that I could know quite well inside and out.
That's right. And it'd be also nice to have no duplication between two systems, so you have to enter two different types of information.
Yes. No, I've sort of been able to work my way around that. I tend to write in my system, which I can then copy and paste into their system, so I'm not double documenting. So at least I know I've got it saved in my system, that I've always got a key record that I can pop it into theirs straight away.
That's right. Thanks, Melinda. Also joining us for our discussion today is midwife Jasmine Kirk. Jasmine has worked in rural and remote midwifery practice and is now enjoying supporting women birthing in sunny Queensland. And Jasmine roller skates. How amazing is that? Welcome, Jasmine.
Hi, Julie. Thanks for having me on.
Now, Jasmine, can you tell me how often do you use digital health systems in your practice?
Daily, at least, probably hourly. I've worked in an environment that's almost fully digital, although there's some room for patient-facing documentation that then needs to be transferred to a digital system. And I've also worked in environments that are almost entirely paper-based, and the difference between these two is really palpable. So the paper-based environments see documentation errors, omissions, mismanagement of information on a daily basis. I think I really identify with what Mel was saying about double documentation because you end up writing the same thing over and over again on 10 different pieces of paper. I currently work in a mixed model, and so we're a long way off of moving to exclusively digital documentation, but having that combination makes for a really big improvement in service delivery.
I think that's a really important point, Jasmine, because we know digital health systems absolutely improve care outcomes, and the data that they collect is enormous. And Nikki and I love data, don't we, Nikki? But there are absolutely frustrations for nurses and midwives at the moment. So we have been talking a little bit about them. Jasmine, where do you see digital health helping deliver better outcomes for women and infants?
So one gap in documentation that I've witnessed with every single birth that I do is in vaccine delivery. Under the previous system, we only ever documented neonatal vaccinations on paper, and we would keep a copy and the parents would receive a copy. Now, which has been really useful with the COVID vaccines, we submit that data to the Australian Immunisation Register, and people can then access the Medicare app and look at their vaccine record, the date and batch number of the vaccine that they received. But there is this gap in the systems where they haven't quite caught up. So for many hospitals, at least 3 that I've worked in, the process of submitting the vaccine information is to write the batch number on a piece of paper, fax or mail that to Canberra once a month, and then I think somebody must upload it manually from Canberra so then people can access their records. This process can take weeks and sometimes months, depending on how many vaccines the hospitals are doing and how often they're faxing things over. It's really labor intensive, and it could be so efficiently solved by just providing midwives access to an immunization registration website. We upload the proof of vaccine directly to a person's My Health record, and they can see it by the end of the day.
Thanks, Jasmine. And just while you were speaking, it reminds me of talking to IT experts over the years, and they get very frustrated by nurses and midwives finding a way around technology because, as you've just highlighted, nurses and midwives are very innovative. We want to do things quickly and efficiently, and you've just found a perfect solution to something that frustrates you on a daily basis.
And what ends up happening is that nobody sticks the batch number to the piece of paper because the vial only has 2 stickers on it, and the parents still need a paper copy and we still need a paper copy. So we've got to write it out, and nobody likes writing.
Thanks, Jasmine. So using these digital technologies that you're using on an hourly basis, how capable do you feel within your practice?
I'm a very confident millennial, and so I feel very confident digitally. However, I have entered into a hospital that was entirely digital-based for the first time probably about 2 years into my practice, and it really humbled me. So I understand now that when learning a new system, there will be a period where I'm uncomfortable, I'm not as efficient as I'm used to being, but generally that stage doesn't last too long. There are other people working with me who have had the same experience, the same difficulties, and they can empathize with what I'm going through. I just really see digital health as a necessary tool to complete my job. So the better I am at working within these systems, the more effective I'm going to be as a practitioner. I don't imagine that when I'm 50 years into my career, all of a sudden we're going to go back to paper. It's only going to become more and more pervasive. And so the better I am at it, the better practitioner I'll become.
Absolutely. You just touched on it, but can you give us a broader view on where you think digital health will progress over your career?
I mean, I started working during the pandemic, so I can really see that digital health is just going to expand. Even just physically, the infection management required to use a paper chart in a room where you're under droplet precautions and in full PPE. It's impossible. So watching the rollout of My Health Record, for example, it's made it really clear that everyday Australians are getting used to using this consumer-facing digital health management. Tech's improving, the back-end systems are improving, and it's not going to be long before nurses and midwives, hopefully automatically, can rely on digital health to manage all of our documentation. Having systems now where an OBS machine I can log into an OBS machine and it will automatically upload the OBS that I've just taken to a patient's record makes it so much easier and saves me 3 minutes with every patient interaction, which really adds up throughout the day.
It's really interesting listening the variation between Melinda described digital health technology advancement and you, Jasmine. As you're from Queensland and Queensland's quite advanced with digital technology, that your experience, and this is consistent with many nurses and midwives, for some, they're just not using paper at all. Everything's digital. And then compared to Mel, who's still sometimes using paper, but has used paper and now is shifting completely to digital. So we've got such a variation across the professions. We've got such different experiences, but we all have to end up in the same point. And I think what you said, Jasmine, about all nurses and midwives struggling initially with the new system, because you just got to learn it. It's that simple. It's not that you're not digitally tech aware or able. It's just that you have to learn a new system.
I saw a patient yesterday where she had been to a dermatologist a couple of weeks ago, and in this particular system this facility uses, they don't have like a separate, say eCase has a separate system where you'll upload documents and external letters and things. So it's easy. I go into eCase, I go into the gallery, I know I can find that letter. In this other system that they use, I have to scroll through the progress notes to try and find the letter from the dermatologist. Couldn't find it yesterday, so I don't know what the dermatologist said. I'm only going on hearsay. So that's why I have to write in my notes based on what the RN has told me today, because I cannot locate that letter.
Yeah, it's amazing. And not only that, listening to Jasmine talk about the vaccines and how long it actually takes. And I worked in general practice, and so what would happen is sometimes it didn't actually get sent off. So you might have been waiting weeks and months for that information to appear, but it was never going to because it was actually lost at the very beginning. So there's so many, and not only it could well be for the dermatologist who had that information. It just didn't go to the next step. It just got forgotten almost, like maybe paper-based sent out to the GP.
It would be faxed. So I'm still finding I still use fax, but a lot of things are faxed.
Yeah. And where does that go if you make one number wrong, Yeah. So it is really interesting. Mm.
And Nikki, that can have really big implications. So for example, my first MMR vaccine when I arrived in Australia wasn't documented, which I then needed to have in order to work in a public hospital. And they wouldn't accept my documentation saying that I went on this day. I don't have the batch number because I wouldn't keep it. But I went on this day, I went to this clinic, I know where I went, I know what time it was, but it doesn't count because it's coming from the patient.
That's right.
So not having that uploaded to the system meant that I got double vaccinated, which isn't necessary and is a waste of resources in order to work in the hospital system where they could have checked my serology or they could have just documented it correctly in the first place.
And that's a big gap. Yeah, and you're both describing it, with this paper-based. If we actually had the electronic system that one spoke to the other and we talked true interoperability, then that wouldn't have happened to you either, because then that information can flow through and it would be visible to all healthcare providers. Yeah,
exactly. And Mel, I really feel you on the double documentation. It is impossible to have a baby without documenting the same event 15 times across 15 different places, whether it's digital or not. It's just everything is copy and paste.
Well, what I used to do before I used to write in my system and then copy and paste into their system. So I've got to be on the computer, but I used to write in their system, get my device and take a screenshot of the notes. So then me going back to try and read my notes was a nightmare because the screen was blurry. That's what I used to do. It's only been the last probably 3-4 years where I've actually done it a different way. Crazy.
You found a workaround, Mel.
Yes.
Yes.
Welcome to the Australian Nursing and Midwifery Federation podcast in association with the Australian Digital Health Agency, talking about how digital health is changing the roles of nurses, midwives and care workers. So now that we've all got to know our panel, it's time to have an in-depth chat about the Digital Health Capability Framework. Before we start the discussion today, I wanted to let our listeners know that I'm super proud that I was involved in the development of this framework, along with a number of other nursing and midwifery professional organisations. The ANMF supports the framework and has endorsed it, as we can see the significant benefits it offers nurses and midwives. So let's get the discussion started. Melinda, I understand that you've used the Digital Capability Framework, which you briefly discussed before. Can you tell us about your experience?
So I found the framework fairly easy to use. It was quite self-explanatory, and the level of proficiency was fairly easy for me to self-assess myself and how I use the various aspects.
Great. Thanks, Melinda. What about you, Jasmine? What was your experience?
I found it really easy to understand once I got into it. The definition of digital health is so broad that it's really nice to have it broken up into these easy to understand categories. And then some of the courses that the ADHA offers are also really excellent for developing a deeper understanding of how digital health is going to affect my practice. The framework is a really good place to start thinking about how my professional practice overlaps with some of the principles of digital health. And I was a bit surprised by some of them. Domain 1's relationship to digital professionalism, both inside and outside the workplace. We all know, for example, that we need to maintain professionalism on social media and outside of work, but this is the first time that I've seen that attitude reflected in a high-level document as well. And I just really think that this will translate to nurses and midwives at all levels of the clinical spectrum.
Yeah, thanks, Jasmine. So, Jasmine, can I ask you, did the self-assessment of the framework help you identify areas you feel confident in and also identify areas where you would like to improve?
Before I started the self-assessment, I was saying, I've been using digital systems my whole life. I've grown up on this. I'll be totally proficient in everything. And I was very wrong. When I started to look in detail at some of these capability statements, I realized that I'm actually at best intermediate in most things. And I was formative in a lot more than I thought. So there's a lot more just to digital health than just ability. A lot of it is about opportunity and supporting other people to feel confident and comfortable, advocating for consumer rights, and about leadership. Completing the framework has made me realize that digital health is still such a new area and that we really need nurses and midwives at all stages of their careers working in all the specialties to be championing its use. It's also about understanding the consumer-facing side of the applications that we use every day so that when I'm educating a family about their neonatal care, for example, I can appropriately show them the technologies that they'll need to use in order to help them out. The other thing that I found was when I finished the assessment, I zoomed out and looked at the areas that needed the most work, which made a really easy summary of which domains I need to focus on. Once I reflected on it, I wasn't surprised that my main area of needing work is leadership. I'm quite new in my career and I still haven't yet explored leadership in many areas. And so knowing that digital health is going to be such a massive developing area, completing this framework has led me to consider some of my career priorities.
Thanks, Jasmine. I think it's really interesting, one, that I think that some nurses and midwives get a little bit overwhelmed by digital technology because they feel this lack of confidence. But what you've clearly articulated there is that digital health the use of digital health technologies is not just about use, it's about having that expertise and understanding of care delivery, and that directly impacts on the digital health use. So the practicalities of actually just using a system is one thing, but actually having that experience and expertise to understand the reason why things have to be documented, how they have to be documented, the outcomes of that care delivery is so important. So I hope that gives listeners who may be struggling with that confidence a little bit more confidence to go out there and be positive about digital health technologies.
And Julie, you touched on this earlier, but a big part of it is opportunity. When I was working in rural practice, my digital health capability would have been much lower than it is now. And often there's different health services and hospitals that are at different levels of their own digital health capability, which then bounces back onto the nurses and midwives. So I think it's important to take a look at something like this so that you can see how much of it is your health service, how much of it is your experience, and to see whether you want to make change in the environment so that everybody moves up a level in terms of their own capability.
Yeah, absolutely. And of course, for me, I see that nurses and midwives should be at the forefront of digital health technology. We're the biggest professions and we should be there and being leaders. So, I've got such passion for it. So I hope that, this actually inspires people to really look at this in their careers and identify where they can develop and where they can lead in digital health technologies.
Absolutely.
So, Melinda, reflecting on the overall outcomes of the self-assessment of the framework, your current role and scope of practice, what do you think are your future learning opportunities for digital capability?
I think for me, it's always going to be a challenge. And I think for the rest of my career, I can't see it becoming, or digital health becoming, a united platform where I can look at one place to find all the information I need. I think it's going to take a lot longer than the next 15 years or so to get all that together. So I probably won't see it happen in my working life. But I think it's really important to have the discussion around how can we make it more streamlined, how can we make it more centred rather than having these different systems everywhere. So because my practice is so varied, I don't feel I'm ever going to be completely proficient in all the digital systems that I use for my work and for my patients, which is a shame. I think it's always going to have an impact, and it certainly does lead to a lot of frustrations. But the importance of documenting and how we document and what we document certainly comes back to standards, clinical indicators, especially for a lot of my practice, which is aged care. So we need to make sure we're providing that minimum level of care, that we are ensuring that the patient, the resident, the client is first and foremost in our practice, and that we're documenting the assessment and the outcomes it's going to lead to their best quality of life.
Absolutely. Thanks, Melinda. So now I've got a question for the panel. How useful do you think the framework will be for other nurses and midwives? Jasmine, do I go to you first?
I think that nurses and midwives listening in would be surprised by where they fall in the self-assessment tool. Sometimes we end up so tied up with clinical priorities that we forget to think about some of the big picture changes that need to be made to the system to make our jobs easier. This framework is a really helpful tool to bring your thinking back to one of those major issues that's affecting service provision in Australia. I think the important thing as well is not to get overwhelmed by it. Just choose your capability based on your intuition and use it as a tool to remind you of the steps that you can take to improve it. I really think that this ties into every part of clinical practice.
Oh, what amazing advice, Jasmine. Nikki, should I go to you next?
It's been fascinating listening to both Jasmine and Melinda and you, Julie, talk about all your different experiences with digital health and where you all fall under different capabilities. And I really agree with what Jasmine's just said about the nurses. You're really clinical and you think about the consumer and their needs during the course of the care. But when it comes to you and yourself and your development in any areas, it's hard to know where to start. So I think when nurses and midwives start to use a digital health capability framework, like Jasmine and Melinda have both said, they might be quite surprised where they actually fall in each of those capability levels. But I think it will really give them a good understanding of where they need to improve and where they need to start for their ongoing digital capability development.
Yeah, thanks, Nikki. And what about you, Mel?
I think doing this exercise and doing the self-assessment certainly made me think a lot more about what I do and how I use digital technology. I think we take it for granted in our busy work days. We just do it. We write notes and we're done. But this made me really step back and think, well, how do I do it? How effective is the current processes and systems in place and how can we make it better? So, yeah, we all need to embrace it for sure. There's no going back to paper in the future. So we do need to embrace it and move forward and make it better for us, all of us to use in our everyday working life.
And I think that's a really important point that sometimes because it's just a part of our daily practice, we just think it's just something we do. But taking the time to reflect on our digital capability and using the tool is a really easy way and really puts it front of mind about how digitally capable are you and where do you want to go next. So the next question I have for the panel is, how do you think employers or managers could use the digital capability framework to support nurses and midwives to reflect on their digital capability? Nikki, I might go to you first.
This is a really interesting area. In fact, how I would think, so just going back to my day in practice, in medical practices, it can be used for the nurses who work in those general practices, but it would be good for the employer to maybe give them the time to do it. Like we talk about how busy everyone is, and this is really important because it really does highlight areas that they can develop professionally, and that doesn't just help the nurse themselves, but it'll also help the patients in that practice as well as the practice more broadly. So I think it'd be really good for the practices to actually allow some professional development time to even use the framework to find out where they are in that situation.
I agree with you, Nikki. I'm never going to disagree with somebody who advocates for more CPD hours for us. I think that we do need a lot more time to work on education and focusing on keeping our practice up to date. I think the other thing as well is employers kind of do need to take the lead a little bit. We don't currently have time to be working clinically and advocating for a lot of the major changes that we need in the system. So I think employers can take some of that advocacy on and say, we're switching over to this digital system. You've got to learn it. You've got to figure it out. And sometimes it's a bit of a chicken and egg situation, but I think if we kind of force nurses and midwives into using these new systems or take away the systems that people have become so comfortable with for so long, even though we know that they're outdated and it's not the best way, it's not best practice anymore, I think employers have to take the initiative on a lot of those ones.
And when you say that, Jasmine, I sort of think it's a whole of practice or a whole of organisation change. So nurses do have a huge lead in lots of things that practices, for example, do. But it's a whole of practice. So it's almost that they could use that framework to assess the practices or the organisation's level of capability, then to also support the nurses who work and the other clinicians in that practice.
Yeah.
Absolutely. It's a really multi-level tool. You could use it with anybody across the system.
Melinda?
We all need a bit more time, don't we?
Yeah.
And as an employer, I've got nurses that work for me. You know, I was sitting here thinking I need to give them time to make sure that they can do it. So certainly when they start with me and they're going into aged care and they have to get used to these new systems, I don't give them a full workload because it's bamboozling sometimes to think, oh my gosh, it's a new system. I've never used it. How do I get these notes in for this patient? So yeah, time and acknowledgement that systems are different and we do need to use them effectively. And, back in my days of working the burns unit, one of the key points that was reinforced to me, what's not documented is not done. And so I always say that to people, and I sometimes reflect on my own practice and think, oh, bugger, I didn't put that note in about I spoke to the doctor or I did this, Well, if it's not documented in the court of law, it's not done. So we have to be accountable for our practice as well and make sure we are doing everything, ethically and legally in our documentation in these systems.
Yeah, absolutely. And I think just on that whole conversation, I think it's absolutely essential that nurses and midwives are given the opportunity and probably demand the opportunity to be at the table when these systems are being introduced and that they're part of the advocacy to make sure that nurses and midwives' voices are really strong because as we've all highlighted today, that they're the biggest workforce, they're implementing care delivery on a daily basis. They can make care more efficient. We know we can do it, but if we're not at that table for that conversation, then how is that going to occur?
And also, once they start using the systems, the nurses and midwives not only understand how it actually can benefit and make their lives easier, but they can also bring other clinicians on that same journey.
And like you said, Julie, earlier on, nurses and midwives will always find the most efficient way to do things, but we need the tools in order to do so. So I think using assessment tools like this to take a look at how we need to expand our understanding will help us to then find those efficient ways of doing things.
Absolutely. So now we have heard how easy and important it is to reflect and assess your own digital capability. I urge you to go to the ANMF Digital Health page or even just Google the Australian National Nursing and Midwifery Digital Health Capability Framework and complete your own self-assessment. Take the time to reflect on your own digital capability. Take the time to identify where you're at and where you want to be. A big thank you to all our guests today. It has been such a rich discussion. You can find the framework links in the show notes. And finally, if you like the podcast, please let us know. You can find us at the Australian Nursing and Midwifery Federation website at anmf.org.au and on social media by searching the Australian Nursing and Midwifery Federation. Thanks for listening.